Good afternoon, everyone. We're just going to wait a few minutes before we jump into things, but we're really glad you're here. If you want to let us know in the chat where you're joining from or which college, would love to know. Welcome, everyone. If you're just now joining us, we'll get started here in a minute, but right now just sharing where you're joining us from. Seeing a lot of Truman College, Kennedy King, Harold Washington, Malcolm X. It's wonderful to have you here.
All right, good afternoon, everybody, and thank you so much for joining us here today for this panel discussion. We are so lucky to be joined by two incredible panelists today. So I want to start off by saying that this event, which is based on Natasha's research and journalism and reporting about domestic and sexual violence amidst COVID-19, that this conversation is happening in honor of the International Day of the Woman, or International Women's Day. And I just wanted to share a little bit about what International Women's Day is. It's a day to commemorate the cultural, political, and socioeconomic achievements of women, but it's also an important time for us to bring attention to issues that continue to affect and oppress women, including inequality, and as we'll discuss here today, the endemic nature of violence against women. I also just want to share that we will be talking about some topics that may be difficult to, they're heavy or difficult to listen to. So I encourage everyone to take care of themselves, to step away if any of the things we talk about are difficult, and to also rep the incredible resources of our wellness centers on each of the city colleges. So just a note of, to be mindful as we talk through these difficult topics. So I want to introduce myself. My name is Samantha Luce. I'm the project director for Project S.A.F.E. And this event was made possible in part through the work of Project S.A.F.E, which is a grant that is funded by the Office on Violence Against Women, the U.S. Department of Justice. Just have to let everyone know that the opinions, findings, conclusions, and recommendations expressed in this program are those of us and do not necessarily reflect the views of the U.S. Department of Justice. So just to share a little bit about Project S.A.F.E. Project S.A.F.E is a district-wide initiative across the city colleges of Chicago, whose mission is to collaboratively develop and implement meaningful, engaging programs to prevent and address gender-based violence on our campuses and across our district. And this is in partnership with Lifespan. We do have representation here today from Lifespan through Jennifer Green. We aim to promote equity in education by reducing barriers to educational access for those affected by gender-based violence by centering survivor safety, empowerment, and healing through a compassionate and intersectional approach. So with that, I also want to thank this event was made possible through a partnership with the Pulitzer Center. And I just want to really quickly give a shout out to Professor Gail Gordon-Allen at Truman College, who's part of City College's internationalization efforts. And she did so much work to make this event possible. And I want to turn it over to introduce Holly Rosewood from the Pulitzer Center, who will introduce our speakers.
Yeah, thank you so much, Samantha. It's really a pleasure to be here. And just for some background on the Pulitzer Center, I'll keep it short because I know we want to hear from our speakers today, but we're a nonprofit journalism and education organization based in Washington, D.C., but the work we support is global. And I encourage you, if you're interested in reading more of Natasha's work or the other work we support, you can visit pulitzercenter.org. So now I will introduce our speakers for today. Jennifer Green is the Director of Policy and Advocacy at Lifespan, which is a comprehensive victim service agency in Chicago. She's done advocacy work on issues of domestic violence, sexual assault, and human trafficking in Chicago for more than 25 years. She's also a subject matter consultant for the Office for Victims of Crime. She previously served as the Violence Against Women policy advisor to Cook County State's Attorney Anita Alvarez, where she created and implemented policy for the second largest prosecutor's office in the country. Thank you, Jennifer. And Natasha Sinyanovich is a Pulitzer Center grantee, award-winning reporter, and former news anchor, covers vulnerable populations, including survivors of domestic and sexual violence, at-risk youth, migrant workers, and educator. She was born in the former Yugoslavia, and she spent 15 years in Rome covering the Italian film industry. She was a contributing editor and translator for the bilingual geopolitical magazine East West before moving to Tennessee to become the afternoon host for Nashville Public Radio, WPLN. Her most recent work has appeared on NPR, WPLN, The Daily Memphian, and WKNO. She speaks 4 languages, and her work has been honored with numerous AP awards and a regional Edward R. Murrow Award for feature reporting. Such a pleasure to have you both here today. And now I will hand things back over to Samantha to get our conversation started.
Thank you so much, Holly. And just one quick point too, if folks have questions, we do have a Q&A section here in the chat. Obviously, the chat's also open, so feel free to throw in your questions and we'll make sure to try and address as many of them as possible after we've given our presenters a chance to share more about their work. So to start off, Natasha, I was hoping that you would be able to share with us a little bit more about your work with the Pulitzer Center and specifically your project, Surging in Silence, and about the effect of the COVID-19 pandemic and rates of sexual and domestic violence.
Thank you. Thank you all. Thank you, Holly and the Pulitzer Center and Jennifer and Samantha and Gail, who can be with us today. For having me here. I am, as most people know, always happy to talk about these issues. I mean, happy is not the right word necessarily, because they are difficult. And like you said, if you need to step away, please do. The most important thing is to take care of ourselves. I was, as Holly mentioned, I was with Nashville Public Radio until 2019. I stepped down in the summer because I really missed reporting. I was a newscaster and was in a studio, in a production room for 6 to 8 hours a day, and really wanted to get back in the field. And then shortly thereafter began working on an investigative project. Shortly, 6 months later, the pandemic hit. And I, in the beginning, very quickly pivoted to education coverage, which I had not done much of before, but I understood that, so as in life, so many, or as in regular life, so many social issues intersect at schools, especially, inequity and childhood poverty and the lack of access to so many resources. But as I was doing that, because I had done a lot of coverage on domestic and sexual violence before at Nashville Public Radio, a lot of advocates started reaching out to me and saying, there isn't enough coverage. We're seeing terrible things or not seeing enough victims, as the case may be, which is even more terrifying. So, and started pointing out, and I thought, okay, I need to do this. And so I started pitching stories to those who became my partners on this project, who I've been working with, my old newsroom in Nashville here, WPLN. The Institute for Public Service Reporting, which has a partnership with WKNO, which is the NPR station in Memphis, and the Institute is in Memphis. And they have a partnership with the Daily Memphian, an online print newspaper, and the Nashville Scene. And I was pitching stories to crickets, basically. And this was because I understood that the newsrooms were severely overstretched. I mean, it was basically playing whack-a-mole and trying to understand just COVID numbers, right? The rapidly moving things of when we were getting are we going to shut businesses down? Are we not? Are we, what's going on? What are the daily rates? But then I thought, okay, I really need to, this is important. This is one of the most pressing issues, even though it's not necessarily treated as such in the media, but it is one of the most pressing issues on earth. And we need to be talking about this, and we need to be covering this. And so I jokingly always say, well, I'm going to get someone big behind me, and then you can't ignore me anymore. And basically, I had never really applied for a grant. I had a couple of grants for a project I'm still working on, and was rejected, and was like, I don't know how to maneuver this world. But thought, let me start at the top. Let me start with the Pulitzer Center and see what happens. And I am extremely grateful, because within 48 hours, I got an email from one of the senior editors and said, we really, we like this project. Let's just work out some of the details. And in a very short period of time, I began. They gave me as Holly mentioned, I'm a grantee of a local reporting grant. And to all of these outlets, to all of my partners, I gave them a list of about 2 dozen stories. It was like a menu of, here are all the things that we could be covering, and they could kind of pick what they were interested in. And I began by looking at the numbers, and specifically in terms of domestic violence, sexual violence as well. And I do not mean this in any way, shape, or form to diminish the violence that is sexual violence, but the violence, but domestic violence, it has been more quantifiable in as much as it is underreported, and the violence was greater in the pandemic, because what advocates were telling me that they saw were far fewer clients. I mean, some had to close their doors, like the family safety centers and the family justice centers, therapists, sexual assault center. They had to close their doors. They were trying to do some work online. For a short period of time, they closed their doors as they figured out how to get PPE and socially distance their spaces. They were saying they saw far fewer clients, but the degree of violence was significantly greater. And then I started talking to police, and they were saying, yes, we're seeing more stabbings, more shootings of domestic violence victims, which then advocates explained, that means that they're waiting longer to come to us for help. And so I thought, okay, so that's going to be the first focus, to try and really parse out for people why the numbers, what does it mean when the numbers are lower, but the violence is greater? What is it that you're looking at? And there were some national editors that I pitched these stories to who said, well, if the numbers are lower, then, is it really a problem? And again, because this is a widely, not just underreported, but misunderstood or just not understood problem. So then I decided what I really want to do is start, I'm going to look at the numbers. The best way to start to help people understand the differences between a pandemic and a non-pandemic is to look at the numbers. What has changed? And, there were some surprising, it shouldn't even be surprising. I shouldn't say that anymore at this point in my career in covering these issues, but that there was maybe a slight dip that the Sexual Assault Center saw in victims who had reached out to them for everything from forensic exams to therapy, but then they leveled out, and they were basically the same in 2020 as they were in 2019, which just spoke to how this is, even the pandemic couldn't put a dent, couldn't basically stop assaulters from assaulting. As I was doing this, as I was working, and what this project also afforded me was a tremendous amount of time. I really took the time to understand these issues, because every time, again, I went into this thinking, I know so much about this, but every time I learned something new, I realized there's that much more I don't know. And then speaking to the district attorneys and trying to understand, what they were seeing in the courts, the virtual courts, because a lot of the courts were closed for months. For most of 2020 in Memphis, for example, what they were seeing. And then unsolicited, the DAs of both counties where Nashville and Memphis are based said, well, yeah, domestic violence makes up half of all violent crime. It's like, what? That's something that that no one had ever said. And, then have decided, every time I do a story on Nashville or Memphis, I put that in there and I put it near the top so that people understand that I'm not here to tell you a story about an individual case, or if I am, It's to speak to, you know, a problem, to speak to the largest criminal problem in both cities, you know, in terms of violent crime, because the other half of violent crime is not one category, right? 50% is domestic violence. The other 50% isn't homicide. It is, you know, and then, you know, again, learning the numbers. I was looking at, there was a spike in domestic homicides, most of them intimate partner homicides, again, because there was a spike in violence. A lot of that has to do with one of the biggest red flags, one of the biggest triggers for intimate partner homicide, for example, is unemployment and the stress that comes with that. Talking about a sudden, you know, a precipitous drop in employment during the pandemic, and an incredible amount of stress, which makes everyone more aggressive, and stress makes violent people more violent. So, you know, so then I started looking into those numbers. And then when I was doing that, you know, realized when I'm talking to police that they said, yeah, okay, we've got about 100 homicides every year, and about, you know, 10 to 12 of those are intimate partner or domestic homicides. I thought, okay, well, how many, you know, what does that represent of the overall cases that you have in any given year? You're like, oh, that's, you know, it's almost negligible, because we have anywhere from 25 to 30,000 domestic violence cases. And so the project sort of took this dual track in which I tried to make every story, but it was impossible to just focus on the pandemic, because if I'm going to tell you why this is a problem in the pandemic, then I have to tell you, you know, why this problem already existed before. And it wasn't like we saw, you know, 10 times more, you know, in terms of data and statistics. It was there were the drops were significant and the spikes were significant, but the underlying problem was so great already that there's no way to get around talking about that. And you know, and in doing that, there was also a lot of push and pull with editors, because editors want a victim. Editors love to speak to a victim or survivor. You know, a lot of journalism is based on, and I understand that you want, you know, you have that human voice that is going to speak to a larger problem. But, you know, and a lot of the stories that I did, almost all of them, if they had a voice, had a victim's voice, because it was very hard to get around from the, you know, get around the constraints of traditional reporting that editors want. But in doing this, what I really also, and this speaks to just beyond, this is for me, beyond the pandemic, is switching focus to perpetrators, which are even harder to speak to than victims, but really, you know, helping people understand this is not the violence that is perpetrated against victims of domestic and sexual violence is not their problem. It is not their issue. The consequences of that violence are the issue, you know, are their issues, are what they must face. But if we're talking about violence, then we need to talk about perpetrators. And that's why, and I'm sort of jumping ahead and just, or not jumping ahead, but this project has helped me, this project has been a springboard for a training that I've created that launched last week with a licensed clinical social worker, that we call Data and Trauma Informed Gender-Based Violence Reporting, because we really want to help people understand the trauma at the root of it and the numbers, you know, the criminal numbers, what you're looking at, not just the numbers that say 1 out of 4 and 1 out of, you know, 9 men are victims of domestic assault, or 1 out of 6 women, or 1 out of 33 men. And the data sometimes varies. These are some of the baseline numbers. You know, according to RAINN, or according to the National Coalition to End Domestic Violence, you know, 1 out of 6 men and 1 out of 33, 1 out of 6 women and 1 out of 33 men are victims of rape, or completed or attempted rape. These are all important things to understand. But what I really have learned from this from this project, and I would not have done it had the pandemic not started, is to shift focus on the criminal aspects of that. Right, those numbers speak to the public health crisis that are domestic and sexual violence. Whereas, you know, if we're really going to look at what the ramifications are and what people, what it means when we tell you these numbers, then we need to start looking at who is doing what to whom and at what rates, if that makes sense.
Yeah, thank you so much, Natasha, for introducing us to your project. And now shifting gears to Jen, I'd be really interested to hear more about how Natasha's reporting on rates of sexual and domestic violence amidst COVID-19 in Nashville and in Tennessee kind of reflect the work that you've been doing or the rates that you've been seeing of domestic violence in Chicago. And maybe if you could also share some of the unique factors that play a role in shaping rates of domestic and sexual violence in Chicago.
Absolutely, thanks. And I'm excited to be here. I'm just realizing I haven't had a chance to say that yet. And thanks, Natasha. Your articles have been so great to read. I mean, I think first of all, right, we know that we're working with very big differences in population size. So it's fair to say that before we start talking about these numbers. Chicago and Nashville are two, very big difference in sizes. But some of what Natasha was reporting on is very much what we saw here in Chicago as far as numbers that were reported. Right away when we first went into shelter in place, calls for service to the Chicago Police Department skyrocketed pretty quickly, but that did not last for a very long time. I mean, it was maybe a couple of months that the volume went very high, and then it sort of leveled back off. I think for those of us in the service industry, and maybe we can talk more about this as questions come in, it was a terrifying time. I mean, it as someone who has done domestic violence services for a long time, shelter in place was terrifying for domestic violence. And then we also had a lot to think about sexual assault. And so what we saw in sexual assault is the numbers went down significantly in 2020 and in 2021, the reported numbers. And so it's really critical to focus on who was calling, but then we also have a whole nother conversation in Chicago about who wasn't calling. And that's really what we were focusing on. Traditionally, there are a lot of trust issues in many communities in Chicago. There are many reasons that folks weren't calling the police and won't call the police. And so we look at those numbers that were reported, but we look at them with a grain of salt, right? Because we know who's not calling, who's never calling. There was this sort of immediate over-reliance on unsafe systems like the police department for domestic violence because they didn't know if there was any place else to call and all these other factors that isolated survivors in their home. Sort of generally, we did see an increase in homicide in 2020. We actually had 55 domestic violence homicides in 2020 in the city of Chicago, which is a pretty high increase from prior years. And then we had an additional, what we know are what we call nexus homicides, which we'll talk more about, I think, as we get through the questions, because one of the things we really are looking at here in Chicago is the intersection between community violence and domestic violence. Sexual assault calls went down though, and we know why they went down. People weren't out of their homes as much, so acquaintance rapes, went down, we think, just because of lack of access to other people. But one of the main ways in Illinois that we often get sexual assault data or find out about sexual assault is when folks go to medical facilities and hospitals for treatment. And people weren't doing that in the pandemic. It just wasn't safe. It wasn't safe to go to an ER to get treatment. In fact, we did see an increase of some folks going to local health clinics. And so we actually made some legislative changes in Illinois for sexual assault nurse examiners and forensic kits and where they could be done because of the pandemic. So that was one of the ways we had to kind of be adept to respond. We saw a massive increase in intimate partner non-fatal shootings. So shootings went up in Chicago in 20. They went up in 2020. They went up in 2021. They went even higher. And we saw that trend go up as far as intimate partner non-fatal shootings. So again, these are what we saw reported. But what we knew is that there were many people not reporting. So we saw a change in how folks were contacting us. Thankfully, Lifespan was very well prepared. We were able to transition to remote work very quickly. I'm constantly singing the praises of our administration who had us, our phone systems come through our laptops. We really just didn't miss a beat except for about 2 days with just getting everything online and getting people to pick up laptops. But what we saw to our statewide hotline was over 2,000% increase in contacts to that state hotline via text. So phone calls dropped, but their texts increased. And so everything we feared about shelter in place, we knew was happening. Sexual assault reports are still, incident reports are still not up to pre-pandemic levels. And so I now sort of think about the pandemic in waves and sort of what happened in the first wave, what happened in the second and the third. And now I think all of us are bracing for what comes next. But similar to the trend you mentioned, Natasha, we were seeing very extreme violence, more violence than, more extreme cases. We have a phenomena in Chicago where most people who are killed in intimate partner or in domestic violence, because we have a different definition in Illinois, our definition is broad. Most people who are killed in Chicago in a domestic violence homicide have no prior contact with police. And so we're very careful about how we utilize our police data because we know so many communities in the city are not calling the police at all.
I mean, that's something when I speak about whether I'm speaking about this project, the reporting in general, or in this new training, I make it very clear to people that you are going to have to triangulate a lot of data. You cannot rely on police data. And also, like you said, there are different definitions. There are 3,500 different jurisdictions in this country. So there may be 3,500 different definitions of domestic violence. Some jurisdictions include, like we do here, roommates. Others do not. And but like Jennifer said, it's considered that only about 50% of domestic violence is reported through the police. About half of it, the rest is through service providers because people go directly to a shelter, go directly to a service provider. And that's for a number of reasons. One is, you may not want to see your partner arrested or your father or your mother, it's most often, and I tend to focus a lot on intimate partner violence. So many victims would like the violence to stop, but not necessarily the relationship. So calling the police is a huge step. There's also fear of retaliation. A very violent person, if they've been taken away by the police, is not, the violence could very likely escalate. And there's also, there is a huge mistrust of police, especially when you're talking about communities of color, when you're talking about, Black victims, Hispanic victims, Indigenous and Native victims. There is so much mistrust. From that perspective, there is mistrust because in some jurisdictions still do this. They used to, if you called about a domestic incident, as they call it, both people would be arrested, both the abuser and the victim, as a sense of like, well, we'll figure this out later. So you're not going to put yourself in that position. And so you really, that there is so little. Sometimes I feel like there's so little viable data, right? I cling to certain statistics and I cling to certain terminology, I think, because it's impossible, because we have not been treating it at the level, we have not been reporting about it, and police themselves and jurisdictions themselves have not been reporting the numbers at the levels that they really are. There are, again, some jurisdictions will parse out under domestic homicides or domestic incidents what is intimate partner and what is not. But in my experience, that's more rare than not. I just finished, as I mentioned, I just worked for Minnesota Public Radio as an editor there and was looking up their statistics, and they don't call them the overall, the Minnesota Bureau of Criminal Apprehension does not call them intimate partner homicides as a category. They categorize them as lovers' quarrels, which is, again, every time I think I can't be surprised, anymore by what I learn. I I do, which speaks to, I mean, that's not just inappropriate, that's insane. I mean, and in my personal opinion, that is insane, because it is not about love, it's about homicide. It is not a quarrel. Many people quarrel and argue, and it does not end in a murder. And it also shares the blame, right? It does not speak to a perpetrator of the crime. And this all, I mean, sorry, I digress, as I do often when talking about this, because there are so many threads, because the data is so hard to come by. There are so many threads that you have to keep in mind when you are reporting on these issues. And in terms of underreporting to police, in terms of sexual assault, I have befriended here. He's a former police officer who actually does not mince words about cops. But he now trains law enforcement across the world, basically, to be trauma informed, especially about sexual violence, domestic violence as well. And he always begins he founded the domestic violence unit here. He's a former SWAT team member. He trains them at the beginning of each training. He asks the cops or the federal agent, the officers, the federal agents, the sheriffs, how much false reporting of sexual assault do you think there is? And inevitably he says, they almost always say 40 to 50%, closer to 50%. So that means every police officer that someone speaks with, every police officer thinks that every other victim that they're talking to is lying, when studies show that it's 2 to 8%. So, false reporting is not a thing that anybody really should be worried about. Right? It's false denials that people should be worried about. And that's another, so much of from a perspective of the media of reporting, so much of what we report on is missing the issue. We need to reframe so much of what we do in order to get to the actual numbers, in order to explain to people why they don't report. Why are the jobs that service providers like Jennifer and others have so difficult in reaching people? Because as many resources as they may offer, they know that so many people there's still so many people out there who are not coming to them.
Although I think one thing I'd like to add to that is I think that service providers are very careful about how we talk about options, and even in Chicago, how we talk about law enforcement or what we do with law enforcement, and being mindful of not even talking about domestic violence or sexual violence with an over-reliance of law enforcement at all. We don't really bring up law enforcement until we're actually talking to someone about some of the options that they have, unless someone has been referred to us from law enforcement. So unfortunately, in Chicago, almost every domestic and sexual violence program has more work than they can handle. That's another byproduct of the pandemic. Right now, many programs have waiting lists. And so for us, I don't think it's so much a concern about, how people are finding us. We have a statewide hotline that's very effective and very accessible by text and phone number, and very well advertised. And then many programs, because we have recognized the over-reliance on, the criminal legal response to both domestic violence and sexual assault, work very differently, as far as for sexual assault being in hospitals, working with medical providers, being in schools, for domestic violence being in schools, being out in the community. We have programs that work with community, we work with community violence partners because of that intersection. And so I do want to say that I think the service community in Chicago is very mindful of the problems that come from the criminal legal system. We have survivors who want to access those systems, and we are there for them when they want to do that. But I would say we have more survivors that don't want to access that system. And then we also have we provide services for criminalized survivors, for survivors who have been charged. And so, yeah, I think for a city like Chicago, that's incredibly important, because we have very significant law enforcement consent decree, history of police response in this city, particularly to specific communities, many communities.
Yeah, and I didn't. So I should just quantify or qualify what I said. I didn't mean that every that every victim and every survivor should go to police or to the criminal justice. Should turn to the criminal justice system by any means. For me, it was really just because that so much of the information that you're looking for as a journalist is going to come from the criminal justice system, and then you have to, and every time you cover, you have to explain why the data is limited, and and all the reasons why the data is limited, and why that is not, why that is, why I'm again, like I also am not by any means propagating that is the only option or the best option, but just to just explain why, also why some of the reporting has, why a lot of the reporting I think has been, whether it's in the pandemic or before, problematic, or just so full of holes, because you're not, you're working with, I mean, I keep repeating myself, but you're working with very limited numbers and a limited understanding often of the scope of the problem.
Yeah, and so I wanted to, speaking about complicating, kind of rates and statistics reporting out from the pandemic, I wanted to ask about how, so we know that, rates of domestic violence have gone up under the pandemic, even if that's kind of resulted in some complicated numbers on people actually seeking support. I was wondering if you could kind of clarify a little bit, what makes it, why did we see these kind of unusual numbers where, we're getting more intense domestic violence situations or actual violence situations of violence that we're seeing, but maybe lower reporting? What are kind of the mechanisms that's causing that to happen? Why were fewer people calling and more people texting? If you could kind of like elucidate that relationship a little more. And also, were we seeing similar things when it comes to sexual violence? And are the reporting on domestic and sexual violence entirely separate, or should we think about them more together? If you could say a little bit more about that.
Sure.
I would say, Jennifer, I mean, yeah, that's your.
I think we have to think about domestic violence and sexual violence differently. Reporting or not, they're different issues. They look different. They have different dynamics to them. There is certainly overlap, though. We often look at sexual violence within DV relationships, and we also, in this state, have many programs that are dual programs like Lifespan that provide services to both, because we recognize that domestic violence, sexual violence, and stalking are part of a larger community problem, that impacts that impacts a certain population or has certain dynamics to it. What we call gender-based violence, what we used to call violence against women, that some people still do. So I think it is important to look at them separately. And I think different things happened. I think the numbers show that different things happened with them. For example, another thing we know is that calls for service might be very high. On average, outside of the pandemic, the Chicago Police Department gets about 550 calls a day for domestic violence, which is an incredibly high number. They do not, however, have that many incidents or incident reports, because what we often know is that folks call 911 because they want the incident to stop. And that is often a trigger that will make that incident stop. We are almost hardwired from little bitty kids, some of us, to call 911 when something bad happens, but we also know that that might stop that incident. And when the police come, we don't want to talk to them, or we don't want to file a report, or even move forward. And so that is something that is very unique to domestic violence. Sexual violence comes to our attention in very specific ways. We have a law in Illinois it's called the Criminal Identification Act, and that it says that if someone is coming to the hospital and appears to be a victim of crime, the hospital is required to call the police. So if I'm a survivor of sexual violence and I go to the hospital to get medical treatment, the police are going to be notified. That contributes to the number of sexual assaults that are reported to law enforcement, Now, if law enforcement comes, I can refuse to talk to them. They still have something that they have to report. So that's in the numbers. So we know that sexual assault decreased because people weren't going to the hospitals. The hospitals were overrun and overworked with the, handling the pandemic. ERs were not safe. But we also know that we have a very huge number of acquaintance rapes in this city. And so there was also less people out and having access. I mean, I think that feeds into the whole conversation about how does rape happen, and that most rape is not stranger rape and it's acquaintance rape. And so, yeah, I think those are two big pieces of that. I mean, the dynamics to domestic violence and sexual assault are different. And so I think we have to look at them differently. And I think, to Natasha's point, the reporting, it's so hard to find the data, and the data tells you a story, but the lack of data tells you a different story. And that different story looks different for domestic violence than it does for sexual assault. I don't know, Natasha, please add anything that.
No, yeah, yeah. I don't think I have you said it all very well, and you say it from perspective that you have much deeper knowledge of this than I do. I mean, I am an outsider to this looking in compared to a service provider, but I do think there is, in the general public, there is there's a strange disconnect that there is. Sometimes people will view them as the same crime, and then when you really start to speak to them specifically, then they will say, well, they hold these contradictory beliefs about it because they think of them as the same. And then when you bring up, and I mean, I know Samantha may be jumping forward in terms of marital rape, which is a term I don't necessarily like very much, because rape is rape, but I know for the purposes of categories, then those same people who view them as similar things will say, well, that's not a thing. That doesn't actually exist. And that, for something like intimate partner rape, is extremely hard data to come by. There's not much reporting of it because a lot of times victims themselves may not recognize that is what's happening in the relationship. And then where it is reported, it's not necessarily specified in that way. And like Jennifer says, I mean, most sexual assault happens between people who know each other, is perpetrated by someone who the victim knows. But we have this image of the stranger in the bushes or in the dark alley. And in terms of sexual assault, I mean, I'm not advocating that anyone walk down a dark alley, but your chances are you're going to be safer walking down a dark alley than in your own relationship or in your own home, because of what the reality really is. So I don't know if that added to what you were saying or if that just took us down another rabbit hole.
I think that's a great point. So I wanted to open up, you both kind of spoke to, some of these kinds of misconceptions about things like acquaintance rape. And I kind of wanted to speak to another common question that I think has probably come up for many people as they have heard information about the fact that domestic violence is on the rise during the pandemic, which is a question people often ask, which is, why does a victim not leave a situation? And I think that's more elucidated during a pandemic where people have less options on where to go, and people are, when they're in lockdown or in quarantine. But I think that the picture is also a lot more complicated than that, of just people staying because of a pandemic and a lockdown order. And I think it opens up questions about, in general, why do people stay in situations of domestic violence? And I was wondering if you could talk a little bit about that, and how the pandemic made that more complicated for people.
I will start, and then I will pass it over to you, Jennifer, because you have far more experience. When people ask me why I want to specialize in these fields as a reporter, my number one answer has become because of that number one question. And the number one, people constantly ask, it's a knee-jerk question: why didn't he or she? Why didn't they leave? And I think, I always tell them, well, think about what you're asking. You're actually normalizing violence. The number one question should be, why does somebody torment a partner or a child or a family member? But if you're talking about, why didn't they leave? You're usually talking about an adult relationship. Why is it normal for someone to torment a partner? Why is it normal for someone to psychologically, or emotionally abuse someone, or physically abuse someone? So, yes, it's complicated, but I think everyone actually knows the answer to that question. They just don't connect the dots, because I know plenty of people who are in just relationships with people that they don't like, very much, or just a sort of a normally boring relationship, let's just say, or they've fallen out of love, or they're not happy, and a relationship where there is no abuser, where there is no abuse happening, and they don't leave very easily, right? It's not easy for any of us. We have plenty of friends. You're like, what? You don't actually like that person, or that person actually doesn't like you. Just leave, and they don't. So, we all understand that on some level. We just don't necessarily apply it to. We think of domestic violence because we don't understand the power and control dynamics in domestic violence, and we don't necessarily want to. We don't apply what we already know and what we have done plenty of times in our own life on a different scale. And then Jennifer can speak to the actual dynamics that keep people.
No, but Natasha, I think your stories were really great at talking about this, right? I mean, not just in the pandemic where people were, there was so much more unequal impact on some communities than others, and so much more unequal impact on some people than others. But I think your story talks really well, speaks to this really well. And, folks don't leave for a variety of reasons. One of which I think is kind of what Natasha was referencing is love, and the other is fear, right? Because of the way the cycle of violence works, because of the way that power and control dynamics works, it's not all bad. I mean, the relationship in a domestic violence situation is not always all bad. I've had a client say to me, it wasn't like he walked up and punched me in the face and asked me to go to dinner. Like it's not that simple. I wouldn't have done that, right? But another major motivator is fear. And for some people, like in the relationship you're talking about, when you have a friend who you're like, you just don't like them that well, maybe they don't leave because of some level of fear. But with domestic violence, it's completely different. You don't actually have to watch the news or read the paper that many days without hearing about someone who left and what happened to them. We have a massive fascination with these stories in our media. Particularly if it's a white woman who was killed, right? This story, those stories and familicide, where somebody kills their entire family and then kills themselves. So these stories only serve to underscore that power and control dynamic of, if you leave, I will kill you, which is a real threat. And you can see that it happens. Also, staying, why people stay have to do with economics. Sometimes it has to do with culture and what your cultural background is. Perhaps it has to do with your faith. Sometimes it has to do with institutional response, right? Maybe you tried to leave, and the institutions that were supposed to be there to support you failed you, and so now you don't want to try again. Fear of losing your children, right? Immigration status. I mean, there's a million different factors that might go into it. And so what's really important is helping survivors identify that. And first of all, providing services that don't require that, right? So Lifespan serves folks who it's not a requirement to them that they have to be separated from the person who's causing harm to them. And that's really critical. We have to be able to support them even when they're thinking of leaving. And then helping them identify what those reasons might be and seeing if there's ways to support them. We also know that it sometimes takes a person up to 10 times before they leave for good. And so making sure that we're there to support if they come back or when they come back. So I mean, I think, again, that's also a reason to talk about domestic violence and sexual assault differently, because the same phenomena doesn't always exist. In a sexual assault that's an acquaintance sexual assault or a stranger sexual assault, you may not have these these dynamics at all. So that makes it very easy to, you know, to separate from that person.
Yeah, I mean, I'm a lot harsher on the media than you are. I mean, being a member of it, but yeah, the fascination with sensational stories, the fascination with or you know, only covering domestic violence, for example, when it rises to the level of, you know, egregious physical assault or death, undermines the complexity and the scope of the problem. Again, you know, if we have on average 10 homicides in Nashville a year, and those are 10 people who should not have died, I don't want to undermine that either, compared to 25,000 to 30,000 cases. That, you know, that's not, again, when I say negligible, I mean that statistically, domestic violence can be prevented to a certain degree. You know, there are prevention measures, but we do not help victims, and we do not help the idea that you can, you know, that you can prevent certain types of violence if we're only covering the, you know, the small percentage that has gotten to a point, you know, that has risen to the level of murder, or that has risen to the level of, you know, and again, you know, some terrible violence. You're not explaining the emotional and psychological violence, or the financial constraints, or the financial abuse that might be happening before that. And you know, and I always tell people, yes, it contributes to the dynamics of Jennifer, of power and control that Jennifer mentioned, and it also contributes to this narrative of the snap, the mythical snap. Reporters love to talk to people who said, you know, I had no idea that he or she was going to, they just snapped, and they didn't snap. Nobody snaps. There is a small, very, very small percentage, but again, that really is negligible, and don't worry about that so much, about, you know, somebody who, for whatever reason, you know, the situational violence was so bad that it actually resulted in, you know, in some kind of horrific assault on a family member or a partner, or murder. Almost every time, there is an escalation of violence. And if you talk to people who say, I had no idea, you're not doing justice to the victim. You're not doing justice to the other victims who are watching, who are trying to, you know, who may, through that story, recognize themselves for the first time, or who are watching to see what happens, you know, when that does happen, and what are the reactions. And yeah.
I mean, on this topic, I want to really point out a local story here that has been really critical, I think, in raising the issue of missing and murdered Black women in the city of Chicago, and a series of articles that were written by journalists. You know, we had an entire series of articles written, and then more recently, the Discovery Channel took that series of stories and did its own documentary on the epidemic of missing and murdered Black women in the city of Chicago. And this is specifically linked to gender-based violence. It's specifically linked to sexual assault, because when they end up finding many of these women, they have been sexually assaulted. And this is a real reflection of what you're talking about, Natasha, and how a news story has really then led to a response. And you know, part of the work that we do is anti-trafficking work. And so we have long known about this connect between murdered Black women in areas where there may be more street-based sex work that were long ignored by law enforcement, that many of us in the community were working to, you know, provide support on and get attention to. And then this series happens, right? And so now we're at a point where there's legislation pending to create a task force in Chicago for missing and murdered Black women. And there's much more conversation about it in the last 2 years than there was 10 years ago, even though this is more than 10-year-old problem, right? So to me, I think it's a great example of how journalism can actually lead the conversation and shift the narrative to what is really a community issue that needs to be focused on.
Yeah, I agree wholeheartedly. But it really is a question of we need to we need to do that on a broad scale, and we need to look at the kind of coverage that we've been doing so far. Everything from the stories that we're choosing to the headlines that we give those stories. I mean, you mentioned a murder suicide, and the majority of murder suicides are domestic violence related. And there was a story here. Again, I don't want to just. I'm very proud of a lot of my colleagues. I'm proud to do the work that I do. But there was a story in the local paper here that community mourns a family shooting. The family shooting was the husband killed the wife and the 2 children, and so just that there's no. It sounds like a home invasion. There's actually one where a woman was killed by her former partner that the headline ran that it was a home invasion. And a home invasion is what we typically use when we talk about a burglary, right? When we talk about larceny. But this story about the murder suicide, the trigger warning at the top was, we're going to be talking about suicide, and if you need help, here are the hotlines you can call. And it did not, and it had and it listed a lot of people in the community who were mourning, saying, we had no idea that this man was struggling so much, the man who killed his family. There was no talk whatsoever of domestic violence and what would have precipitated that, because again, something happened. And if you're only talking to people who didn't know, well, then who did know? Find out the people who did know. If you're talking to family members and neighbors who didn't know, or maybe they were enablers, maybe they were, maybe they did know, but now they didn't want to know. They didn't recognize or admit or acknowledge what was happening. So yeah, so that I feel that is very much our responsibility. We really can reframe the conversation and reframe the issues in a much better way than what we've been doing so far. And it's something that you mentioned, the term gender-based violence is, I think, a lot better than violence against women. I often say even that is passive, right? We talk about the brutality of women against women as women's issues, which is something that I always talk about. Like, unless you're talking about lactation and menstruation, that's you're not talking about women's issues. And I don't want to say that that women cannot be perpetrators of violence and that there are no male victims, because there are. And there's a lot of stigma about, there's been a lot of ignoring of that, and there's a lot of stigma around that. But we also do know that the majority of victims of domestic and sexual assault do tend to be girls and women. And even, just to finish that, like, violence against women is also this, I find it to be a passive term, as if we're just, there's no accountability. The ghosts are violencing us. And that's not, we have a lot, all this to say, we have a lot of work to do in the media.
And I do want to talk more about this point on accountable language. I know it's 2:00, and so there are a number of people that are going to have to drop off. I just wanted to make the note to participants that we will, this conversation will be going on for the next half hour, for those of you who are able to stay. But for those who have to jump off really quickly, I just wanted to share, Holly, if you don't mind enabling screen sharing really quick, I was just going to share a quick set of resources for folks who want to know more about what we have available here at City Colleges. And I'm just waiting, Holly, for that screen sharing. Okay, here we go. So really quickly, I started off by speaking a little bit more about, Project S.A.F.E. And we do have a lot of resources available here. So really quickly, for help locally at City Colleges, you can always contact your wellness centers. Every college has a wellness center. And I know many folks present here today are from the wellness center. Additionally, through our partnership with Lifespan, we are able to offer victim services, comprehensive victim services that are free and confidential. You can call the number here on the screen and ask for Project S.A.F.E. Lifespan is open during regular business hours. They can also be contacted at safe@lifespan.org. For after hours calls, we also, Lifespan has a partnership with the Illinois Domestic Violence Hotline. The number is shown here. They're also familiar with Project S.A.F.E. And any student or CCC affiliate who calls can be routed to Lifespan during business hours, but they can receive 24-hour crisis counseling or crisis support as well. City College's safety and security are also deeply involved in this project, and they can also be contacted. They can assist folks with, if they do want to get in touch with local law enforcement or explore other options, talk about a safety plan, enforce an order of protection on a campus. That's something that safety and security can help any students, faculty, or staff with. Additionally, to find out more information about how to get involved at your campus, you can reach out to me through the Project SAFE email address, which is projectsafe@ccc.edu. And to find out more, you can also access the Project SAFE website, which is www.ccc.edu/safe. I'm going to put that in the chat too. Since it's a little bit of a tongue twister. And just a little more information on the things that we can support students, faculty, and staff with. This includes access to legal support, both for civil and criminal legal issues, counseling, connecting with medical services, safety planning is a really core one, advocacy, immigration relief, as well as academic support and accommodations. So if you have any questions, I'm going to put those email addresses and those numbers in the chat for you, but I just wanted to make sure folks had a chance to review that. So going back to, I don't know if Jen, you wanted to make a point about what Natasha was saying before I jumped in with my slides.
I don't think so.
Okay. Well, I was going to ask, this was actually one question that came through the chat. Someone private messaged me about, you had talked about too about the in Minnesota where an intimate partner homicide was characterized as a lover's quarrel, and just generally the kind of, I think it's fair to say, sometimes irresponsible ways that we use language, unaccountable language, to talk about gender-based violence in the media. And so I wanted to ask, do you have any examples of words or phrases that we should be wary of using when we're talking about these types of issues? Or I guess on the flip side, what is the right way, when we talk about domestic violence, even in conversation, how do we kind of push back against kind of normalization of this passivity of domestic violence? So for example, I never use the language that someone has experienced domestic violence, but rather that they have been subjected to, or domestic violence has been perpetrated against someone. And so I'm wondering, what are some of the ways in which you kind of push for more accountable language when talking about these issues?
Are you asking me?
Yeah.
Yeah. I didn't know if it was, I mean, I know you're asking both of us, but if you're asking from like a media perspective, yeah, that I would say experiencing domestic violence. I mean, there are moments when I do use terms that I don't necessarily like, just for not repeating certain, if I have an article in a short amount of time. I hope I have never written that somebody experienced domestic violence. I really hope I have not. I also would say someone subjected to it. As I said before, the SNAP, women's issues, lovers quarrel. I didn't even think I had to, when we were compiling the list for our training of terms not to use, it never even crossed my mind. I just happened to be researching the Minnesota data. Underage sex, for example, because there's no such thing as underage sex. Two minors can have sex, but if an adult is having sex with a minor, that can be child molestation. That might be molestation. That might be rape. That there are other ways of putting it, but we tend to. These are really difficult emotions for people to deal with, right? These are very. When I say people, I mean the general public, and I see this even among reporters that they say, well, we don't, I don't even use the word rape because that sounds really harsh. It's like, but that is the criminal complaint. Now, as a reporter, I cannot use certain words, especially if I'm talking about, somebody who is in the criminal justice system, or if somebody has not pleaded guilty to rape, I cannot convict them and say that they raped somebody. But if we are talking generally if the article is not about a certain perpetrator, don't be afraid of the word rape when that is what it is. Don't water things down. I personally, and I do not like the term date rape for the same reason that I talked about before with marital rape. I feel like date rape definitely waters things down, especially because most people do know they're rapers, they're rapists, and those who perpetrate sexual assault against them. We use that as a way, I feel, the way that I've seen it used both in the press, in the media, and just in life, as a way to dismiss the act that, the brutality of what someone was subjected to. And it perpetrates this idea of, again, the stranger in the bushes, right? The stranger in the dark alley, when that is, more than 90% of the time, that's not who is doing the perpetrating. And I'm trying to think other senseless act. When people talk about, especially brutal domestic violence, they talk about something being a senseless act. I think, well, no, that person actually had a reason for what they did. You have to understand that reason, not to condone them, by no means to condone the act, but to understand. If we're going to talk about violence, then we need to understand why people do violence. We can't just, why people commit such violent acts. Otherwise, again, we rely on this idea of, well, they just snapped, and I don't have to understand any more than that, which also then perpetrates another misconception of anger management, that domestic violence is an anger management issue, when most perpetrators are very good at managing their anger in the workplace, with their friends. They are not, they do not emotionally and physically, they're not as emotionally and physically brutal against other people as they are against their partners, or their children, their family members.
Or they're not brutal at all to those people.
Or they're not brutal
right?
at all. Yeah. Right. They're
Right.
I mean, that's also why a lot of times people don't know, some people, not I'm convinced there's always somebody who, there's somebody who knows, but yeah, they tend to be very charming. They tend to be, they often are very charming, and that's again, that's why somebody falls for them. Like Jennifer said, nobody says on the first date, nobody punches somebody on the first date, or nobody says on the first date, despicable things to the person, to then a potential victim. I actually I've had problems with even date rape drug, because that's not that, even that takes accountability away, right? It's not those are actually medicines, right? For insomnia or for other problems, they are used by perpetrators of rape. They themselves are not, like, it becomes shorthand for something that we actually, that we then don't really have to talk about, and don't, we, again, this blameless, this lack of accountability. Most people, they are often slipped into drinks, right? They're often slipped into alcoholic drinks in some kind of social setting. It doesn't have to be alcoholic, but they are surreptitiously. So it's not that the drug isn't the problem, and nor is the drink the problem, because most people don't think, and shouldn't think, that they are in the presence of a rapist if they're having a drink, if they're with one person, or or in a social setting. So those are some of the bigger ones for me. I'm sure Jennifer has.
I feel like I could talk about this a lot. I'll touch on some of the ones that Natasha mentioned. I mean, right, we don't say date rape. Acquaintance rape is really how we talk much more broadly about it, because date rape, I think, also gives you this idea that it happens between two people who are in a date-like situation. And it doesn't account for things like family members or family friends. It's a broader term to help people understand that sexual assault often happens from someone in a variety of ways, right? And not just because you're on a date. It could happen from somebody that you go to school with, and you're not on a date, you're just having a private moment somewhere. Date rape drugs, we talk about drug facilitated. That sexual assault was made easier by the use of drugs, and including alcohol as a drug. I mean, there is very deliberate use of alcohol in some settings to facilitate a sexual assault. Being careful with the actual terms you're using, sex assault versus sex abuse. Those mean different things legally in the state of Illinois. We don't have a legal statute that says rape, right? That's not, but some states do, to Natasha's point. So you have to think about how you use that term. Going to the anger issue. I mean, for me, when we're talking about domestic violence, it's really critical for me to highlight that domestic violence is a learned behavior. It's a learned behavior, and it's not because someone's drunk or they have anger issues or had a bad day at work or any of those things. It is a learned behavior that person has found works for them. And so they continue to use it, which is why they can use it so selectively with some people and not others. And, you know, we always have sort of this conversation about victim versus survivor. Many survivors that I work with in the anti-trafficking field don't like either of those terms, and they talk about themselves as having lived experience. So I am someone that has lived experience with trafficking, which I find myself using most often. But depending on what system you're working with, you may hear victim quite a bit because that's the language of that system. So I do think it's really important. Words matter very much, and how we talk about it definitely matters. How we talk about it to folks with lived experience. I'll also say, I'll add one more. You know, for a long time, the domestic violence community talked a lot about abusers, right? Her abuser, their abuser. And I think we're being a lot more careful as a movement to frame that as people who have caused harm, versus, you know, an abuser, because of, you know, a lot of different reasons, but mostly because I would never say to a survivor that I'm working with, your abuser did that, right? We mirror the language of the folks that we serve. That's a really critical piece of advocacy. We use the term that they use. So, you know, I think it's really important from a service perspective to be very thoughtful about the language you're using. I also think it's very important from a journalism perspective to be thoughtful. And those are, you're going to use language in different ways for different reasons, right? Natasha and I have different goals in mind when we're talking, and who we're talking to. So, but it is very critical.
Yeah, I mean, and I actually don't like using the terms victims and survivors personally. I don't like the terms that much, but I also know that it is the fastest way I can explain something often, and especially in radio where you don't have the luxury of a paragraph, you know, where you can explain something in a paragraph or even in a long sentence. I may only have 2.5 minutes or 5.5 minutes, you know, to explain to tell you this story, to deliver this news story. And so I have to do that, and it becomes unwieldy, and it's always like a little, like, it hurts my heart, but it becomes unwieldy if I have to then say those with lived experience of trafficking as opposed to trafficking victims, right? You may not actually be able to understand the sentence if I say it a certain way. But yeah, it is important, and I try as much as possible to mirror, when I do speak with survivors, to mirror their language, and to, you know, and ask them how, you know, how would you like me to refer to you? You know, or I may have to refer to you as a victim or a victim survivor. Is that okay? If I literally don't have the space and the time for it. And to that also, and this is not necessarily language, but with every story that I do, I will circle back, because sometimes it could take, you know, days or weeks or months to do a story, depending on how the interviews line up, who I've spoken with, you know, the information that I've gathered. But I will always at the end circle back with the survivor and say, are you still on the record? You know, so this story is meant to air, you know, tomorrow or next week, or they suddenly told me tomorrow, they had pushed it back. If you're not, tell me, and it ends there. I will find someone else to speak with. I will rearrange the story. We will do something else, or you know, or just lose the story altogether, because someone who has been under the power and control of another person should not be under the power and control. I have an extreme amount of power as a journalist when I speak to vulnerable people. I think a lot of journalists don't want to admit that, because we love to say that we hold power to account, but don't necessarily want to hold ourselves accountable. But I feel like there is a huge power imbalance when I'm speaking to potentially anybody, but and I don't do this. I don't circle back to a politician and say, hey, are you still on the record? Or because they can fend for themselves, if they've been on the record, if they but I will speak to somebody or say, these are the terms that I'm using, and this is how I've described this. Is this accurate? Or am I belittling or diminishing your experience? Or have I not understood?
I want to applaud that, Natasha. Thank you. I mean, thank you, because it's really critical for the for the folks that I serve, and it's not often, and it really shows a knowledge of trauma, and you have a different job than I do, but it's clear that you have figured out really great ways to take some of the job that I do and apply it to the work that you do, and that's really amazing for survivors.
Thank you. I always say I'm never happy with any of the stories I do, because I always know everything that I've cut, like all the things that I had to leave on the floor, all the stuff that was on the proverbial cutting room floor, because I may talk to somebody, a 5-minute story could be actually, behind that is 6 hours of interviews with 4 different people or something. But I always say it like, I'm when a story comes out, I will always circle back with the survivor and say, okay, I know you said you were happy before. Are you happy now? Is this okay? Like any feedback, any criticism you want to give me. So the most important audience is the survivor, and then advocates, and then service providers. Because, and I will take feedback and say, and so much of what I've learned has come from listening. I think I was naturally trauma informed in a lot of ways, but like I said, learning all the time. And for instance, something that up until last year I didn't think about was abusive relationship. And an advocate told me that, like, there's no such thing as an abusive relationship. Relationships don't have emotions, people do. So, they had actually not said, they said use abuser or perpetrator, but don't use abusive relationship. And I thought, oh, of course. Here's this really passive thing. Again, there's this blameless, it was just the relationship that hurt people, not, that hurt somebody, not a person, not a human being that hurt another human being. And like you said, it is learned behavior, and really trying to make people understand that. As an editor, I am often telling reporters, think very hard. And if you're going to speak to the family member, this was in Minnesota, they do a lot of crime stories, not typical to public radio. They do a lot more like TV news. And there was a particularly gruesome intimate partner murder. And the reporter had wanted to, quoted the parents as saying that this young man had mental health issues. Like, did you get a diagnosis? No. Okay. So, you're already explaining something that you actually know nothing about, and you're talking to the family, and you're very likely talking to the people from whom this man got his behavior, right? From whom he learned the violence. So, think, this is sort of a little off topic, I think, from although it is under the umbrella of language of what we're going to say and not say. You're already condoning, you're already justifying. And this happens very often with the murders of women, when men, and particularly white men, perpetrate homicide. When they kill a woman, you will very often see in the media that the person had mental health issues, even if you don't know what they were. You've never spoken to their therapist, there's no diagnosis, there's no anybody who commits murder, who commits even in just plain, in the most justified self-defense, is in a mental crisis in that moment, right? It's not. So what does that really mean? So let's get away from this. Let's get away from language that for the most part is passive, potentially sexist, potentially racist, and very often blameless, without any kind of accountability.
Yeah, thank you for that, Natasha. I just wanted to also mention a question that we have from Lucia about the Illinois definitions of sexual assault versus sexual abuse. Is that something that you could share, Jennifer?
I wish I could off the top of my head. As you can see from the other, I think someone else put the statutes are very long. Yeah, the statutes are in there. So I cannot say them off the top of my head because as you can see, there's a lot of different elements, and that's just sexual abuse. What I can say, Latia, is that we are going to talk about them in length in our upcoming talks with you guys, but their sexual abuse and sexual assault, specifically in Illinois, have to do with penetration versus not having penetration. And so I think that's kind of the short answer I can give you without going through the entire statute. But really, they're thinking about sexual conduct, sexual abuse is more looking at things like fondling, touching certain body parts, and they also have to do with age. There's a lot of different age restrictions between criminal sexual assault and sexual abuse. So it's kind of a lengthy statute answer. So that's my short answer. And not a great one, but we will get you more info on that.
And as we kind of wrap up here, I just wanted to end following up on our conversation too about accountable language. If in general, there are any other steps that the general public can take to support victims of sexual and domestic violence, victims, survivors, those who've experienced sexual and domestic violence.
Yeah, I mean, I'll say from my perspective, I think educating yourself is huge. Like stories like Natasha's go a very long way. I think when you know someone who has been sexually assaulted or has experienced domestic violence, whether it's your family or your friend, it can feel really challenging to provide support. It can feel challenging to know what to do, what to say. Sometimes when you have someone that you love that's in a relationship where there is abuse happening and you want them to leave, all of the education that you can get around what that person is experiencing is helpful. Domestic violence is about power and control, and a tactic of power and control is isolation. And so abusers work very hard to isolate the person that they are causing harm against from folks who might support them. So I think doing panels like this is so great because education is a really, really critical piece to supporting folks, but also holding perpetrators accountable. We know the criminal legal system is not effective for everybody. So we, could have another hour-long conversation about community accountability and what accountability looks like from others in your community or your family. I would say also I'd be remiss if I did not say that every domestic violence and sexual assault service provider in the city of Chicago needs volunteers, needs board members, needs people to help them fundraise. And so, figure out what works for you and see if you can support if you're in that position to do that. And I'll stop there in case you want to add anything, Natasha.
Well, I mean, you're in a much better position to speak to that, but I would say, yeah, support them. I mean, believe them, because there's a very, very high probability that they are not lying, that they are not exaggerating, that if anything, they may be, downplaying the extent of the assault, of the continuous or specific, abuse or violence that they are being subjected to. And I mean, as I did, what the last story I did for this project actually was about a new law that was passed here in January based on an Illinois law in which beauty industry workers like beauticians and barbers and nail salon workers have to get mandatory domestic violence recognition training, basically awareness training. And I mean, it's half an hour. So you're not, you're not learning not that I don't want to sorry, I don't want to undermine that. It's not that you're not learning very much. I mean, you could, you need to study this for days and years to really understand. But the biggest point of that training, it speaks to the isolation, because often hairstylists and barbers are the only people that an abusive person will allow their victim to see by themselves, right? It could be a doctor or it could be a hairstylist. There's a very limited to somebody who really exerts that much power and control. And really the number one point that they want people to learn is listen and provide resources, because if you push somebody to report, if you push somebody to leave, chances are you are pushing them back to the person who is abusing them, the person who's causing them harm, who is hurting them, because it's very hard. They may get defensive, they may get, like, again, and I want to, to what I was saying before. I mean, I've been in a relationship where I was like, it's kind of a jerk, like it's not even that. And again, like, where there was no fear involved, but when a friend would say, well, just dump the guy. I mean, like, what? Well, maybe we've been together long enough where the life change, just the change in itself was a little bit daunting, or I was going through other things. And that didn't help me. So, you know what? You're right. I should just make this big change. I'm gonna dump my boyfriend, or I'm going to, I'm gonna leave my job. I've been complaining about my job. I'm just gonna leave it now that you told me to. Chances are, we don't work that way. And when you're talking about victims of domestic violence and you're talking about victims of sexual assault, it is that we all experience in our lives multiplied by, I mean, infinity in a lot of cases, because the violence is so much greater and so much more profound, and the reasons to stay so much greater.
Thank you for that. Thank you both, Natasha and Jennifer, for being here with us today and sharing your expertise and your really deep knowledge and understanding of these issues, and for sharing with us, particularly in honor of International Women's Day, about an issue that affects so many women, so many people. And I want to thank everyone who made this possible today. I want to thank the Pulitzer Center, Truman College, and specifically Truman's Project S.A.F.E coordinator, Gail Gordon-Allen. And I want to thank everyone who was able to come today. I see Patty's question in the chat. We do have a recording of this, which we will make available to the Project S.A.F.E.
Oh,
I think we just
we lost her.
Samantha, but this recording will be on the Pulitzer Center website, and we'll make it available to city colleges, to Project S.A.F.E if they want to repost it as well. So if you want to listen again, share it with folks in your network, definitely do. It should be up hopefully by the end of this week. So appreciate that question. Till then, thank you again. I hope you all have a great afternoon. It's been a pleasure.
Thank
you
you all
so much. And happy International Women's Day.
Yes, thanks all.